Welcome to my channel. I'm Dr. Naeem, and today we're talking about a serious but preventable viral disease, measles, also called rubeola. In this video, I'll explain what measles is, its causes, symptoms, complications, treatment, and effective home remedies to help relieve discomfort. Let's begin. What is measles? Measles is a highly contagious viral illness caused by the measles virus, from the paramyxovirus family. It mainly spreads through airborne droplets when an infected person coughs or sneezes. The virus can live in the air or on surfaces for up to 2 hours, which is why it spreads quickly, especially among unvaccinated children. Signs and symptoms. Symptoms usually appear 10 to 14 days after exposure. High fever, up to 104 degrees Fahrenheit or 40 degrees Celsius, dry cough, runny nose, sore throat, red, watery eyes, conjunctivitis, tiny white spots inside the mouth, Koplik spots, red, blotchy rash starting on the face and spreading to the body, weakness, body ache. The rash typically lasts 5 to 7 days and fades gradually. Complications. Measles can be dangerous, especially in children with low immunity. It may lead to ear infection, diarrhea, and pneumonia, a major cause of measles-related deaths, encephalitis, brain inflammation, blindness, malnutrition, death in severe cases. Causes and risk factors. The main cause is infection with the measles virus, which spreads through respiratory droplets. Risk increases if the child is not vaccinated, vitamin A deficient, malnourished, living in crowded or unhygienic areas. Treatment. There is no specific antiviral drug for measles. Treatment focuses on symptom relief and preventing complications. Paracetamol or ibuprofen for fever and pain. Ciprofloxacin, 500 mg twice daily. Hydration, plenty of fluid. Vitamin A supplements, reduce severity and death risk. Antibiotics, only if secondary infections like ear or lung infections develop. Home remedies. These home remedies can provide comfort during recovery. Lukewarm sponge baths help reduce fever. Honey plus warm water soothe cough and sore throat. Steam inhalation relieve nasal congestion. Carrot and spinach juice, rich in vitamin A. Fenugreek tea, meti, helps with body aches. Rest in a dark room to reduce eye strain and light sensitivity. Keep the patient isolated to prevent the spread of infection. Make sure the patient stays well hydrated and gets plenty of rest. Preventio. And the best prevention is vaccination. The MMR vaccine, measles, mumps, rubella, is first dose at 9 to 12 months, second dose at 15 to 18 months, or as per local guidelines, 2 doses provide long-lasting immunity. Measles is preventable and treatable, but early care is essential. If you found this video helpful, like, share, and comment below. And don't forget to subscribe to my channel for more health education. This is Dr. Naeem. Take care and stay healthy.